My name is Dr. Richard Granese, and I'm a board-certified psychiatrist. Substance abuse is on the rise in our society, especially in Southern California. Why is it that certain people will use drugs and alcohol and have transient effects, and other people will use drugs and alcohol and have permanent, long-lasting effects? The answer to this is we don't know. The brain is the most sensitive organ in the body. While we have learned much about the human body and the brain is still uncharted territory. The effects on the brain are unknown in many circumstances, and basically there is no safe drug. Alcohol is the most commonly abused substance. 14 million people in America will abuse alcohol. The effects of alcohol can range from transient, such as intoxication, including motor impairment, cognitive impairment, and disinhibition, which can lead to poor choices. Long-term use of alcohol can result in various organ damage, such as the liver, pancreatitis, cardiovascular disease, dementia, or even death. Marijuana is the most commonly abused illicit substance in the United States. The effects of marijuana on individuals will commonly be displayed as symptoms such as what we call the amotivational syndrome, where people who are apathetic, they don't want to do things, or just plain lazy. Long-term effects can lead to cognitive impairment, lower IQs, and paranoia. What I see on the rise is increased use of marijuana and people coming into the hospital with psychotic illnesses. Once they come into the hospital and they display psychosis, my job as a psychiatrist is to try to help repair the brain. And so I will use different medications to help, if you will, glue the brain back together. Sometimes we can get the individual back to their normal baseline functioning. Other times the damage is permanent. Marijuana use, especially in the youth, is most dangerous. New research shows that individuals who smoke marijuana on a regular basis prior to the age of 17 are 60% less likely to graduate high school or even college. We also see that individuals who use marijuana in their youth will be 8 times more likely to use other illicit substances later in life. The treatment for drug and alcohol abuse is a 12-step program, abstinence, psychotherapy, and potentially psychiatric medications.